dun, dun, dun. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Trying
Bob.
to get the energy level
Yeah.
up, you know.
Pump it up.
7 neck pain relief self-treatments proven to work.
Right.
And the reason we know they're proven to work is we've used them on patients for years and years and years, thousands of patients.
Right. That's no
And-
kidding either. We got 50 years of treatment between the two of us.
Yeah, so we've been around. We're like old dogs, you know, that we ready to probably go.
Yeah, the gray hairs coming in.
Yeah.
Yeah, we had a comment about. Well, anyways.
Okay, we're moving on.
Sometimes, you know, on those comments, I just wonder, they're wonderful people, but sometimes, anyways, with neck pain, we got to get rid of this pain. And the first thing, oh, Bob,
You want me to
the
what?
gray hair, we
Yeah.
forgot. There's people out there.
Oh, is because we are losing our memory too? Is
Yeah.
what you're saying?
Yeah.
If you are new to our channel, by the way, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we'll help you with your memory if we can come up with some ideas ourselves. Also, go over to Facebook. Yes, go over to Facebook and like us because Brad and I, as children, we're not liked, and we're trying to turn things around. And it's Bob and Brad. I don't know if you can see that on there.
Down here.
That's where you're going to find us.
That's
So-
the blueprint if you got good vision for blue.
Yeah.
Okay, so one thing as therapists, and we just know that almost always, if you have pain and it's orthopedic or, you know, due to joints, there's an association with loss of range of motion. Things aren't moving like they
Very
should.
good point, Brad.
So the first thing we do with neck pain, I'm assuming you do this, Bob, just like I do, is we say, let's get your neck. We don't say, can you bring your head forward? Can you tuck your chin in? Can you look up? Can you bring your right ear to your right shoulder, left ear to left shoulder, turn to the right, turn to the left? And that covers all the planes of
all the
movement.
main directions, and we're looking for a loss of movement.
Right.
And quite often we find one, usually almost always we find
Right.
one.
It's very common when you say, can you look back up towards the ceiling? Oh boy,
Yeah.
that hurts. If that's the case, you know, you're not able to look up, it creates that pain. Then we got the 2 exercises that can help you get past that pain. Once your range of motion comes back, oftentimes, the majority of the time, the pain goes away with it.
Right, so our goal is to restore the motion and decrease the pain. That's
Right.
they usually go together.
Precisely,
So
Bob.
you want to start with the extension, Brad? That was the one he was just mentioning. Quite often, very common one is that people lack the ability to go back like this. Because why is that? Because most of our day is spent forward like this.
Right, we're
not-
looking at our computer, we're looking at our cell phone, we're driving, and we get this posture thing, and things get locked up from a prolonged period of poor head posture and head forward posture.
Very rare that I find someone is lacking motion going down. Is that true, Brad?
Right, this is normally not a problem
not a
for
problem.
most people.
So it's
what
the
do we
going back.
Yep. So the first thing to do if this is a problem is you're going to do a chin tuck. Okay, bring the chin in like this, not down and in, but straight back, like someone's going to take a pie and throw it in your face. You just go whoop like that. If you want to give it low overpressure, you can if it feels good, and that'll help stretch that out. So if you do this and the pain in the neck feels like it's going towards the center, and usually in the low neck, if my patients say, boy, it hurts more, but it's right down here, I'm smiling because I know we're doing the right thing. We'll continue to do chin tucks, pressure on, pressure off, up to 10, and then once it starts feeling better, then we start trying to get full extension without pain.
What's nice about the chin tuck is it's realigning you, kind of getting you in the right direction.
Right.
Plus, you're getting some movement in the spine.
Sure.
And movement generally does help decrease pain too. You're getting more blood flow to the area, a little more synovial fluid probably,
Right.
and everything gets.
You just have to regain that motion in a relaxed manner. Don't get aggressive with it. Use the tricks that we're talking to you about. I like to take a towel roll like this, and once you're trying to get motion back like this, it's not real comfortable yet. Little support here. And then there's a couple ways. Bob's going to show you one way. I'm going to show you this way. And that support, I have often have patients say, oh, that feels a lot better. Now I can move it with, and it actually starts to feel better with repetition. And a lot of times you'll get back, and then you can start to move your hands up like this. And Bob's going to show you.
Yeah, I have to admit, Brad, I never did that one. And,
You mean
and
with it rolled up?
with it rolled up, I always did it this way. And now I'm finding that a lot of times people like that one better. I hate to admit it, but I think you're right.
Well, Bob, you know, things happen. You know, once in a while a miracle
The
happens.
blind pig does find the acorn once in a while.
Why do you have to always bring up the blind pig? You know, let's go on. Let's show them.
All
But
right,
this is
in
a
this
really
case-
nice technique, the selvage or
Yeah,
the
selfage
the edge
or
of the towel.
shellfish, the edge of the towel. You can put it on different levels of the neck. That's what's nice about this
It is.
this one, because you can work on different levels. I usually start right below the ear, and I put this up so I'm looking at it with my eyes. And then as I can go ahead and work back, my thumbs follow my eyes, and my eyes follow my thumbs.
So he's pulling out this way, so it's
Yeah.
actually giving some traction to the neck along with it, which can be very beneficial. Again, when you do this, it should feel good. It's like, oh, I can move better, feels better, everything's
You
improving.
can usually go further, too.
Right.
You can usually go back further. So then I can go even a lower level here. And again, I got angled up here. The reason I'm angling up here, the joints are angled that way.
Right,
so I'm
the
going
facet
along,
joints.
The facet joints are angled that way.
Again, do this only if it improves it, if it feels better. If it produces some sharp pain, you know, there's something else going on. But oftentimes these are very successful.
An important point to be made, though, Brad, is that you can do it 10, 15 times, but you can do it every hour.
Right.
So, I mean, this is something you can do throughout the day and should do throughout the day.
Right.
Not just once a day.
Right, as long as it's making
Feeling
it feel
better.
better, right? You know,
Yeah.
if you're in the office and you got to get your towel roll out, you know, you got
Yeah.
to do what you got to. It only takes a couple minutes
That's
to get
right.
through it.
You'll have the whole office doing it soon.
Right.
So-
It'll be the end thing. The next thing, if you could look back like this and down and it's pain free, but if you bend the right ear to the right shoulder like this, in one way it feels good and the other way it doesn't. That's one way to look at it. Bob, you want to talk about this? Works with you because
Yes, it does. This is the one, and I think it's because of this, Brad. When I write notes, I'm always tilted one way. And so I'm loose that way. You know, I got plenty of motion that way, but I don't have good motion this way.
Right.
So I'm like this all the time, and that's what you want to find out in life. If you tend to be like this all the time, you're probably going to be tight here, and you might get some relief by working on that direction. So the first thing I do is you want to make sure you do maybe a chin tuck or so,
Right,
because
so
it
we're
gets you lined up, because you don't want to be doing a side bend like this.
yeah,
You want to be lined up real straight and then do the side bend.
right.
So I do these, you know, when I'm starting to get pain, and I'll do a chin tuck, and I'll go to the right. Oh, feels good right now even, Brad.
Yeah.
And then eventually you can do a little bit of overpressure even.
Sure.
And, you know, just take your fingertips so you don't get too aggressive. You don't want to grab your head. And just go ahead and give a little extra stretch like this.
You just gently. You got a lot of leverage up
Yeah,
here.
you do.
And you don't need to. And if you have to get at, if gentle doesn't do it, then go to the next.
Same thing with
step.
this one. You're going to do it every hour if you can do
Right,
it. I mean,
right.
or even more often than that. So,
And
all
then
right.
if that's not doing it and you feel tightness over here, you may just have a tight muscle. You may have that levator scapula muscle is tight, which connects the base of your occiput over down to your scapula. And the way you're going to stretch that out is, here's my pocket. I always tell my patients, just look down into your pocket, over to the side, take the other hand, grab the base of a chair, and lean over, and that locks the scapula in place. Look down into that pocket and gently stretch. Now, these muscles are not real big muscles, so you're not going to get aggressive. We don't want to, tear them. We just want to gently stretch them. Again, fingertips only. You can do a little. I only use 1 or 2 fingertips is all you need to get a little more stretch, and you'll feel that muscle stretch. Hold it for 30 seconds at the most. A lot of times I like to do pressure on, pressure off, and each time it feels like it's getting a little bit looser.
Important
up to 10.
important that you do lock things in place by grabbing onto the chair.
Right.
That makes a big difference, and you're going to see what a difference that feels
Yeah.
like. That's really kind of a cool feeling.
If you're in a real chair, you can grab around the armrest. Usually the armrest is too high. You want to grab down lower, and that helps drop the scapula into place where it locks in.
Wonderful.
Bob.
All right, next we're doing rotation.
Yep.
Yeah.
Let's say that keep your shoulders still. Look over your right with your shoulders locked into place, and then look over your left. And if it looks like this, and you can feel it's like you get so far over and it locks up and it's painful, then we need to stretch that out in a in a nice mechanical fashion that's going to work without irritating it.
So we usually do it again with the selfage or shelfage or whatever it's called.
Yes.
Why can't we remember this?
We always get corrected. People
I
always
know.
in our comments, and I think it's SALVA. That might be wrong.
I think it's SEL.
Oh,
salvage.
yeah.
Anyway, so you're going to go ahead and set up in kind of the same way that you were for extension. And I'm going to work on right rotation. So what you do is I'm going to drop this arm down, grab over like this, and this one's going to pull straight down, and now I'm going to pull over to the side like this.
I'm going to
This is going to help kind of facilitate a little bit.
You're going to the right?
Yeah.
Okay. So I'm going to show from this angle. It's important that you go up higher than the jaw.
Yeah, you don't want to come around like that.
Yeah, because that just cuts your windpipe off, and then you don't breathe very good.
And also,
that's not
don't
good.
bring this one across like this.
Right.
This one goes straight down.
Yep. And it's amazing what that does. That support around the neck really allows a better stretch, and have a lot of success with this. The biggest problem with this is teaching people how to do it properly.
Right.
It's a little confusing.
We'll go the other way now. We're going to go to the left. And so again, drop it down, switch hands. This one pulls down, and I'm going to the left. And the thing about this is always make sure this shoulder is not coming with you.
Right.
This shoulder should stay back. Sometimes we actually have people hooking around the chair.
Yep. So I'll do this with my patients. I'll hold them to let them feel that difference.
Excellent.
So yeah, that's a nice stretch for that
Especially
rotation.
you have trouble turning around and looking out the back of your vehicle when you're backing up.
Right.
So-
Now, if you're really tight and you're having a hard time and it feels like the muscle is all knotted up in there, a lot of times it's nice to get some heat down there. And we really do appreciate some deep heat that works well, and that's that far infrared that we get using the Thermatex infrared hot pack. And with this one is a smaller one.
Yeah,
but
this was designed for the knee.
Yep.
We don't have our other one here that actually the Platinum model is the best one for this
Yep.
because it actually comes with straps. You could strap it on. And the reason we don't have it, both Brad and I are using ours.
Right. I was just using mine this morning, and like I do most every morning. But this one would work. It's a little bit smaller, but it's still big enough to cover the neck. Why don't you turn around, Bob, and they can see that. So when almost 2.5 inches, 60 millimeters, and that's going to get deep into these big muscles, those upper traps, and get into the levator, which is below those upper traps, and loosen that up and get that circulation
I don't know
going.
if you were clear on that, Brad. It's like regular heat only goes a couple millimeters.
Sure.
This goes 60 millimeters, which is 2.36 inches.
2.3, right.
2.36 inches, so it goes much deeper than regular heat.
Yep.
And we've noticed the difference. And it's already a real steady heat.
Right.
I mean, it doesn't fluctuate up and down, and there's only one button that you push, and it
Right.
puts
Yeah.
the heat on.
So if you are looking for a good quality infrared, far infrared heater, these Thermatex, we're just sold on them. We love them.
Yeah, and we got a code down below you want to make sure you use because you'll get free shipping, plus you'll get a percentage off.
A discount.
A discount,
You
yeah.
bet.
So,
Okay, well, good luck with that neck pain, and just say goodbye to it.
yeah, sounds good.